We are now recording. We are continuing on with week number 6, head and neck. This video will continue with assessment of the mouth, the head, and the neck. We will begin with the mouth, which is number 24 on your physical exam skills checklist and guide. Number 24, inspect the lips.
Ministry, turn this way for me.
Inspection of the lips is very important. This is also a common site for skin cancer, especially at the vermilion border. Next, we will inspect the gums, the buccal mucosa, and the teeth.
Can you open your mouth for me?
You will use a light source for this internal oral examination. Inspect the tongue, using your tongue blade, you can also inspect the posterior pharynx, and have the patient say "ah."
Miss Hayden, can I get you to open your mouth real wide for me? Stick your tongue out a bit. Just say "ah."
Ah.
Thank you.
Using a wet 2x2, you can continue with inspection of the tongue.
Miss Hayden, I'm going to ask you to open your mouth for me and stick your tongue out just a little bit. I'm going to put this one below and one on top.
You will flip the tongue to the right and inspect. Now flip the tongue to the left and inspect. Inspect the floor of the mouth under the tongue.
Good. Thank you.
You will continue with a bimanual palpation of the gums, the floor of the mouth, and the buccal mucosa. Using both hands, you use your thumbs and your fingers and palpate all surfaces inside the mouth, feeling for any lumps, bumps, or tender surfaces for the patient.
Thank you.
We are now continuing with the head and neck examination. You will need to inspect the anterior neck for symmetry and verbalize to the patient that you are inspecting the neck.
So I'm looking at your neck right now.
Next, you will palpate the carotid pulses. Examine both sides, palpating one artery at a time, over the lower neck or the upper neck, not over the carotid sinus. Use fingers or the thumb for the carotid pulse. Next, you will auscultate the carotid arteries bilaterally. Ask the patient to hold the breath for a few seconds. Examine both sides using the bell of your stethoscope.
Ask you to hold your breath for me. Okay, breathe. Hold your breath one more time. Thank you, breathe.
Next, you will palpate the isthmus of the thyroid gland. You will do this from behind the patient. Have the patient extend the neck slightly.
Miss Hayden, I'm going to ask you to jut your chin out a bit. So just, there you go. Not raise, there you go. Thank you.
Next, find the cricoid cartilage. Find the trachea. In between those two landmarks, you will find the lobes of the thyroid gland. At this time, ask the patient to swallow. It will lift the cartilage and you can palpate the thyroid gland.
Miss Hayden, can you swallow a couple times for me? Good, one more. Excellent. Thank you.
Now we will continue with palpation of the lymph nodes.
You can turn your head for me a little bit. Thank you.
Using the pads of your fingers in circular motion, begin with the preauricular nodes in front of the ears, the posterior auricular nodes behind the ears, and the occipital nodes on the back of the head. Next, palpate the mandibular nodes at the angle of the jaw, the submandibular at the mid-jaw, and the submental under the chin. Next, locate the patient's sternocleidomastoid muscle.
Next, you turn your head just a bit. Raise your neck. Thank you.
On the posterior side of the sternocleidomastoid, you will palpate the posterior cervical nodes. On top of the sternocleidomastoid, you will palpate the superficial cervical nodes all the way down the entire sternocleidomastoid muscle, and then you will palpate the deep cervical nodes deep in the sternocleidomastoid muscle. Lastly, you will palpate the supraclavicular nodes, making sure there is no Virchow's node on that left side. This concludes the head and neck examinations through numbers 36.